Hey everybody, today I want all of you eye doctors out there to sit down and write down what you do when you do a comprehensive eye exam.
All right, it's time to get serious. You ready?
Hello, everyone, and welcome to Blind Spots with your host, Dr. John Armando, co-owner of Westminster Eye Care Associates and Uppercut Consulting. Blind Spots is independent optometry like you've never heard before. Does your practice have a purpose? Blind Spots is all about experiencing the roller coaster journey of developing the true purpose of your practice and, in turn, living a more fulfilling life.
Write all the things down, and I want you also to write down how long on average it takes you to do all of the things you do, every part. So does it take you 5 minutes when you're doing a slit lamp examination? Does it take you 15 minutes when you're performing a dilated fundus examination? Whatever it is, cover test, Worth-4 dot, and get an estimate of what that is just in one day. Then at the end of the day, I want you to look at it and I want you to get faster. We need to get faster with our eye exams. We take too long. We take way too long. What are we doing at the slit lamp that takes 15 minutes to look at an eye? I mean, are we dozing off? What's going on? We shouldn't need to take long in the exam room. Things should be delegated out, that's number one. However, as the doctor, there are so many doctors that take so long to do an eye exam, I don't know what you're doing in the room. So, when I first started, I took way too long. And I started to realize that patients didn't want to be in the room that long. And then I started to realize, well, what was I doing? I was doing the things that, especially for new grads, need to listen to this. I was doing the robotic things that they taught in school. Sitting there, going through the slit lamp exam, looking at things forever, when it would take a second to look at the same thing. Where now it takes me a second. Before it might have taken me a minute. So, what are we really doing? Are we just doing it to do it because that's what we were told to do? Or are we doing things because we're focused on something? We're focused on the patient's chief complaint. That's how we need to be performing our eye exams, around the patient's chief complaint. We need to solve the patient's chief complaint. That's what we need to do. Besides that, we need to look for anything medical that's going on and be an investigator and kind of make sure that there's nothing going on that can hurt or harm the patient. Now that doesn't take long. I've changed my exams. I must have done this where I sat down and re-looked at how I was doing eye exams at least 10 times to try and become more efficient. You wouldn't believe if you were to just sit there and go over your own protocols of allergy follow-ups, dry eye follow-ups, comprehensive eye exams, contact lens fits, contact lens trainings, and really sit there and think about what you're doing. You will shave off so much time. You can add 5 to 10 more patients a day onto your schedule because of this. Believe me, I've done it. So, at the point now, we are highly delegated, but we see about 35 patients a day. And the exam is extremely thorough. but it's all about sitting down at the end of the day, reworking your exam routine. And that word routine is key, because it becomes a routine, it becomes a habit, the certain ways you do things. And these habit forming things at work are hard to break. It's hard to get yourself out of that routine and into a faster routine. Very, very easy to be lazy. The brain loves to take the easy way out, loves it. So counteract that. Write down how long it should take you to do certain things and do it. Implement a new exam strategy. Go in there, work hard, get what you need, get all the information you need, and spend more time with the patient, just talking with them and explaining things like the type of glasses they need or contact lenses they need, what would be of extreme value to them depending on what they do for a job or in sports or recreation, outdoors. Those are the things you want to be talking about. You don't want to be sitting there at the slit lamp looking for 5 minutes at what? At a normal eye? At a normal eye? So come on, docs, let's we need to be faster. Let's get faster. That translates into more money, and it becomes easier on you. Much easier. Makes the day go by a lot faster. That's it for today. Have a good one.